So let's say you're a pharmacist and a patient comes up to you and says, "Hey, I've got this bottle of fish oil." It says it provides 300 milligrams of omega-3 fatty acids and to take it twice a day. So that's a 600 milligram total daily dose. Is that good? And I can give you an answer. Sure. And let's say this patient has a lot of time on their hands and they want some free medical information and they say, "Oh, thank you. Why is this good for me? Oh boy, I'm glad you asked. I love to hear myself talk." So a lot of the interest in the health benefits of fish oil can be mainly attributed to this guy. This is Dr. Jorn Dyerberg, and him and his mentor, Dr. Hans Olaf Bang, and some of their colleagues proposed an interesting question over some of the years that they had been treating their patients. So their team observed that the Inuit population, which is the native population of Greenland, had a lower incidence of coronary artery disease compared to the general population of Denmark. And they also observed that the Inuit population's diet mainly consisted of fatty fish and sea animals like seals and whales. So this begged the question for the team. Does this diet mainly consisting of fatty fish and sea animals contribute to a lower incidence of coronary artery disease? So the team evaluated the blood lipid levels of these patients, and they found that there was an increased amount of a particular omega-3 fatty acid in their blood, and that was eicosapentaenoic acid, EPA. So they made the correlation in this patient population that an increased amount of EPA was responsible for the decreased incidence of coronary artery disease. And we couldn't control for that variable yet, but what we could control for was the amount of fish that patients were eating, and it spearheaded a lot of observational data to show that fish in the diet can decrease all-cause mortality from coronary artery disease. As we entered the 21st century, we finally started to control for omega-3 fatty acids in clinical trials, but unfortunately, the data was either not strong enough or there wasn't clinical significance. Like in the Omega trial, patients took 1 gram per day of omega-3 fatty acids in a supplement after their first heart attack, and after a year, it did not reduce the amount of sudden cardiac deaths versus placebo. But thanks to the Reduce It trial in 2018, we can now say with confidence it's not a total of 1 gram per day to reduce your chances of a second cardiac event. It's a total of 4 grams per day, so it very well could be that EPA all along. And this is why Vascepa exists. It's 1 gram of pure EPA, so that's 2 capsules twice a day. But keep in mind, this is for secondary prevention after you've had a heart attack. As for the over-the-counter fish oil, yeah, you're going to be lucky if you even get 250 milligrams of EPA, but this is not for secondary prevention of cardiac events. This is because of that data in the 1980s where people were eating lots of fish. So if you don't eat lots of fish, then